When Abby McMahon was 2 years old, Mom and Dad spotted some pretty unusual bruising.
It was weird because she was 2 and fell all the time and was clumsy, just as all 2-year-olds usually are.
But this bruising seemed pretty atypical for a typical 2-year-old.
They kind of then just kept showing up. And it was maybe this is not normal.
Hi, Abby.
At this point, they contacted Abby's Sanford Health pediatrician, Dr. Jennifer Hager.
I saw that picture and when I looked at it, I thought the same. I'm worried that this isn't normal and that something more serious could be going on. And so I suggested a visit. We were able to get her here in clinic that day.
So it was really reassuring to get her in that quick, but that also was like, oh man, this really means something intense. And that was kind of worrisome and a little scary to think.
I was able to confirm what I was worried about in the photo, which was that the rash was petechiae, which is something that happens when the blood vessels are breaking open or the platelets aren't doing their job normally. So we did some lab work, which thankfully we can do here in clinic.
Abby's lab work showed a low platelet count, which Dr. Hager says can be really dangerous, putting Abby at risk for serious internal bleeding. So with a quick phone call to the Sanford Children's Castle of Care, Dr. Hager got things moving.
I was able to call over to our pediatric hematologists, who are really the specialists in blood disorders and anything having to do with platelets, and they agreed. This was concerning and we needed to make sure we got Abby treatment to keep her safe, and we were able to arrange for her to be directly admitted.
Through Sanford Children's and physician subspecialties, that is the standard of care.
We are really fortunate to have the relationships we have, that we have expert physicians in very specialized areas of pediatric care, and that I have the ability to access them when I need it. Having the ability to access that does nothing other than make sure the patient gets exactly what they need.
So Abby and the McMahon family were off to the castle for an IV infusion therapy treatment.
The team there was just like, okay, we're going to get this from pharmacy, we're going to get them all hooked up, and then we were just kind of there for the night. Just kind of chilled and let that infusion therapy happen, and the next day her counts were already coming back up.
Which tube slide?
Abby continued some routine blood work for the next 6 months just to make sure her levels were safe.
And she's still very active, still kind of clumsy 7-year-old.
Today, this 7-year-old is fully recovered.
This is why we are here. So I get to be with a family in really joyful times. I get to be with a family in more challenging times. Most of the time I get to see them and their medical concerns been addressed and they're living a happy, healthy life as Abby is, and I get to see that part of it too. Looks good. Great here.
Knowing that Dr. Hager could just quickly call her colleagues and have an action plan and a game plan same night was amazing. I didn't expect that. Honestly, I was thinking, we'll maybe get a diagnosis of what this is, and then you come up with a plan, and maybe we'd have to do something in a day or two, and it was, nope, we can get you in and done, and it was so fast.
Did you get your swing set put back up?
And so it's just amazing that type of care exists here.
For Sanford Health News in Sioux Falls, I'm Courtney Collin.